Welcome back from that break. We are looking at breast cancer. We know that the month of October is actually a month where uh, we raise awareness, especially on the cancers, especially that are so much pronounced among women. There are quite a number, but today we are looking at breast cancer. Before the break, we looked at the risk factors, we looked at some of the danger signs, but now we want to look at the screening. When I go to hospital, what happens? What do they do to confirm that indeed what I have is a breast cancer? And if they realize that, or if they recognize that I have breast cancer, uh, is cutting off my breast the only solution? Now, pity for the men who don't have the other bulging breasts. What do they cut if cutting is the solution? Well, doctor, we are back now. I have checked myself. I've seen some abnormal. Some abnormal signs that are not really normal. They're not really the usual ones I see on myself. I've come to you. What happens?
Yes, what happens, of course, after you realize that you have something abnormal on your breast, you have to tell us clearly what happened in words.
Oh,
Yes. You
I
tell,
might have fought and I'm just nursing an injury, and
yes.
I claim that I have cancer.
Some others can get you can get an accident, you get an ulcer on your breast, then you come. So you have to tell us what happened, how long has that ulcer been there, how long was that heaviness, how long has been your that size of the breast increase more than the other. So you tell us, then we shall have where to go. Uh, after getting the indications or the risk factors, of course we shall ask you a few questions. Y- You have a relative who has gotten breast cancer. Is there anyone uh, in your family? We shall ask you. Of course, we shall take also your weight. Yes, we see if you're obese, how to have the risk factors. We shall say, have you been smoking? Mhm. Yeah, have you been, like, we shall ask everything. So thereafter, if we, 60% of our diagnosis is by talking, not by testing. So we continue and get you go to an exam. Doctor will tell you to undress. Yeah, doctor will compare the breast, will touch, will feel everything. And then after, if still is suspecting anything, we go on to do some investigations. Yes, where we shall do in Uganda here. We have actually improved. We have almost everything. So, but most facilities use ultrasound scan. Yeah, the ultrasound scan will see something abnormal. But if you go to Cancer Institute, they normally use the mammogram. Yeah, mammograph. So it's like an X-ray also, very sensitive for breast cancer. Some other improved hospitals go as far as doing an MRI, magnetic resonance. So so that's how you screen. So it's like triple assessment. You do a clinical exam. Uh, you do you do the investigation. At the same time, you do a biopsy. Mm. A biopsy, depending where your mass is. Some patients will come with an ulcer. That one's very easy. Just go pick up the biopsy. Some others will come with a lump inside their breast. There are some other methods we use without not surgery, but we shall use a needle aspiration. So we go and get something from there without doing surgery on the breast. So the cutting off of the breast comes after we have confirmed that you have breast cancer. And which stage. So we shall stage. When we stage, that will determine you either need surgery, you either need chemotherapy or radiation therapy. So the treatment varieties depend on the stage. We just don't cut off the breast like that.
Yeah,
Eh,
very many women think that the moment they tell you that you have breast cancer, then the option is cutting it
uh-uh.
off. What other options are available?
The other
Treatment
options,
options.
the treatment options. So we have chemotherapy. Chemotherapy, they are given in circles. So if you confirm breast cancer and the stage and the type of the cancer you have, yeah, you undergo chemotherapy, which was also divided into two very main drugs inside. Now we have radiation therapy also. We expose, you put radiations on your breast and uh, it kills off the cancer cells. Yeah. We have debulking surgery. Now the other lady you talked of who has
Yes.
a very big breast.
Yes.
We do debulking surgery. We go reduce the tissue to a minimal size, then we start treatment. So it's like addition to the chemotherapy. You debulk, then you add the chemotherapy. Yeah, it's like you don't cut off the breast. Yeah, it's a
At what
misconception.
point do someone's breast, because we've seen women, they cut off the first breast and then after some time even the second one is cut
Uh this is not read books.
off.
It's what you're supposed to know.
Okay.
So what happens?
Mm.
We may find out that you have stage 1 of cancer. We go on. We tell you the best treatment modality for you is surgery. So we remove the breast. So there are two things that can happen. The other breast can still get the cancer uh, from scratch. It can still drop also the cancer, or we can go on to operate that breast, but still already the disease has already moved to the other breast. The body shares blood vessels, shares lymph nodes, so the disease can just spread through them and they go to the contralateral breast. Yeah, but otherwise, uh, that's the treatment. We give you a treatment depending on the stage.
Okay.
Yeah. So, but there are a few mothers that undergo that torture, where the other breast also gets the contracts the disease. Uh, but all the same, if they also contracts, we start from there. We don't neglect you.
You put it off.
Uh-uh. Depending on the stage also.
Oh,
Yes.
okay. Now you're talking about depending on the stage, but another question would be, of course, why? Because you've talked about the other options, alternatives, treatment alternatives. Then why can those alternatives work out for all stages? Is there really a need for this breast to be cut off? And in cutting it off, what is it that you are trying to eliminate?
But as I told you, as I told the watchers and the listeners, the cancer has the ability to move. It can start from the breast and you find it in the lungs. You can find it in the abdomen, inside your intestines. It can actually go as far as to the brain. It can evade. So the cutting it off, as you call it, the operation of the breast off, we are minimizing the metastasis or the movement of those cancer cells. If you have in stage, of course, in stage 1, they also have sub stages in. So depending on the stage, we cut off. Sometimes we go ahead of cutting through up to the axilla, over to the armpit. That's how we call it in English. Yeah, we can go ahead and cut it from the armpit because, so depending where it has gone. Yes. So we cut it off to prevent. Some others are invasive. So as I told you, there are also in cancers, there are also types of cancers inside. So there are those that minimal invasive, there are those that are very invasive. So even if you're on treatment, they will still grow. So if our pathologist, we have pathologists who go and contact, who do the histology and what. So they will tell us this is invasive, this is non-invasive, this is minimal invasive. So the invasive one, you may start your chemotherapy, but it is already resistant to the chemotherapy. What will happen? To just surround, it just grow and invade every organ around. So what you do, you cut it off as you're treating. Mm? There are those, as I said, some signs, some have lumps. It can start as a lump. So if you have gotten a chance and come early and the lump is still in good stage, we just remove the lump and the cancer stops there.
Okay.
Yeah, and if you have gotten, there are very many success rates of treatment. Yes, high chances of getting cured of breast cancer. If you come in early stages, those who come in late stages, we are still under. Yeah, with technology advancing, we shall also be able to do what, to cure them. But those who come in early stages, yeah, surgery is part of that treatment modules that cure completely. And if you do surgery and you cut it off the breast, the reoccurrence is minimal. But if you do chemotherapy and the rest, the reoccurrence is also there. Uh, so we just encourage the mothers to be aware and no, and always seek for a medical attention. Yeah, for us we shall do what is required, and that save them. Yeah. Mm.
There's something we believe in, that prevention is better than cure.
Mm.
And what preventive measures can someone undertake, especially when we talk about breast cancer?
Uh, of course, prevention starts from the risk factors. Uh, so if you have a first degree relative, how are you going to prevent breast cancer? Normally come for eye screening. Yeah? Once in a while, you come for eye screen as scheduled by the doctor. Come screen, go. No, it takes 1 year to 3 years. You come every year or after 3 years. Don't live a sedentary lifestyle. Mm? Yeah, don't become obese. That's what I'm meaning. Don't smoke. Mm? So there are some risk factors that are avoidable, but there are some which are non-avoidable, like genetics. For it, the the moment you screen every year, every after 3 years, and you get to know that something is happening, that's when we shall act as early as possible. Yes, but uh, the rest of the risk factors, the earlier you realize the risk factors, uh, and you leave the habit, breast cancer will be. But awareness, we are preaching awareness wherever we go. That breast cancer is within us, and it's here for us, but we are here for it. We have to prevent it. Yes.
Okay.
Yeah.
Doctor, we've seen interventions like the HPV for cervical cancer. Are there any interventions for like vaccination against breast cancer?
Not yet. Not yet. There's no vaccination. For HPV, for cervical cancer, because it is symbiotic. Let me say it's an organism over a microorganism. So we are able to have vaccines for it. But for breast cancer, since there's no specific organism that causes breast cancer, we normally don't. We are here to find a vaccine, so it's not there. So far, we have no vaccine. Yeah.
So
Yeah.
because what I realize from this is that unlike other cancers that might have causes, this one picks from the other cancers.
And breast cancer is more of a gene, genetic. It's more of we have at a molecular level, uh, as if you classify a human being, is made of organs. So the organs are made of tissues. The tissues are made of cells, and the cells are made of DNA. So the DNA itself has molecules that makes it. So any alteration at a molecular level in a DNA, that's where breast cancer comes from. Yes. So it's not like other the others. Of course, every cancer is from the alteration of molecules of the DNA or mutations, but they have a specific, let me say, uh, uh, like HPV. HPV, human papillomavirus, the one for cervical, normally is responsible for cervical cancer.
Yes.
What happens when you get that persistent infection? The HPV has the ability to go and invade and attach on your DNA, and it changes its way of thinking and working. So it becomes you get a cancer. But for breast cancer, you just have to get a risk factor that will go and change and get cause a mutation at the molecular level. Yes. So within you, not externally. Yeah, that's what I can say about that.
Wow. Doctor, now, of course, when you talk about cancer, I think this is instinctively normal, if I can say. The moment someone is told that you have cancer, uh, the first thing they remember is death.
Yeah, I'm going to die.
I'm going to die. They start seeing themselves alive. They start seeing death. But which message of hope do you have to the people out there, especially now that we are creating awareness? Which message do you carry for the people out there?
You know, when you are treating our patients of cancer, we don't do it as an individual. We have a team. So a team will enable us to treat you as a whole, psychologically, spiritually, mental. You know, so that you're treated everywhere. So the doctors, we shall do our work. We shall tell you we're going to give the medicine. Then we shall send it to the counselors. They will give you some message. We shall send you to our dear nurses. They also give you a message and treatment. So you'll get a holistic care. We shall give you money, and most of them, in fact, if you come in the early stages, we give you actually much hope. The rest, we have the palliation team.
You
Yeah.
die happily.
Yes. Not dying happily. We try to prolong your life
Okay.
with happiness. We are going to be giving you treatment
And hope.
and hope. You see, some others, the believers, they normally say the doctors treat and God cures. So for us to treat, even if you come in your higher stages and God cures you, why not?
Okay.
Of course, even if you go and you try searching for statistics, you may find patients getting cured with higher stages. Depending on the type of cancer, there are those who have minimal invasive, but they are of high grade, and they are good. They can respond to chemotherapy. They respond very well, and they will get cured. And then there are those who have high invasive. So the rest are technical, people will not understand. But as you go in deep, uh, cancer has types. Each type has its treatment. So the, the earlier you come and detect which type of cancer you have, the better it is. Yeah. So the awareness is, of course, when they get the signs, they should immediately seek for medical attention.
Okay.
Yes. Anything that abnormal on your breast, it's no longer yours now. It's now healthy.
Okay.
Yeah.
Lastly, this would be our last question, Doctor. We talk about the earlier you come, and someone might say, might calculate this in terms of maybe hours or days or weeks or months.
Mm.
So someone would say that because earlier you told us a time besides the genetic factors and all that, that at least if you're aging,
Yeah.
you should frequent
Yeah.
some of these tests. But someone, how long should someone spend uh, from the first test to the other screening to
The
the other?
screening, screening. I think 1 year, 1 year to 3 years. However,
Every after 3 years or every after a year?
either after 3 years or after 1 year, depending on the risks. There are those you come, you had, we operated you. We got, we did a lumpectomy, or we removed the lump. That one, you have to come every year. The risks are high. There are those you come, you find, you're still okay. Spend your 3 years. Yeah, though there are also other risk factors that I left out, like late menopause. Mothers who, let me say, late menopause, that means that those who still go into menses at a later age, above 50, they're also exposed, they are more prone to breast cancer. Then there are also almanac. Almanac, that means uh, going into menses at an early age. Yes,
That is,
that's a
I
risk
think, so
factor.
common these days. I've
Uh,
seen very many parents saying at 9 years,
yeah.
at 10 years.
So that's also an increased risk, and also yeah, taking a long time, the late age of your first baby. Yeah, actually, it's in mothers. The earlier you have, the earlier you become a mother. Let me say you become a mother. The less, or the prevention of most of the uh, tumors in females you prevent, because you find ovarian cancers, endometrial cancers, breast cancers, all of them are prevented by having a first baby early. Now, if someone will ask me how early is early,
Exactly. But
Eh,
they'll find you in a clinic and, and you explain
eh,
to them. But doctor, as
eh,
we wind up this
mm,
discussion, what are your last remarks to our viewer out there?
yeah, there are some marks that Ugandans actually should have a habit of seeking for medical attention as early as they see the signs. We have gotten some issues with patients having poor health seeking habits. They come because of a lot of pain. Hmm? Not because of some pain, but a lot of pain. So they have,
After trying out very many painkillers.
yes, we have self medication. You feel some pain in the breast, you go to a nearby pharmacy. Of course, they will give you the painkillers, expecting you to go early morning to say what? A health worker. But Ugandans have that self medication. By the time they come to, seeking for medical attention, already this has progressed. Yes. So I advise the fellow Ugandans, yeah, to seek for medical attention as early as you feel not okay. Something is lacking on your body, in your mind. So we have very many doctors. You have spiritual doctors, you have physical doctors, you have mental doctors. Yeah, seek. Yeah, they should seek. Of course, for the men, for us, actually, men have a poor seeking, yes, poor health seeking habits. That's why they come with uh, advanced stages of disease. Yeah, yes. I do encourage even also men to come. Yeah, you also increase the risk. As long as you have the risk factors, you come. We shall see, and we shall manage you as a whole. Mm.
Thank you so much, Dr. Arnold, and thank you so much, you, our viewer. We've come to the close of this show. It is very important to know some of these things because you never know when you will need this information. But the fact that you listen through, at least you can help someone else. And when we raise the awareness, probably the prevalence will also come down, because tomorrow it might be you, your wife, your daughter, your mother, anyone. So it is important that we listen through, we also share with others. Now that means get to our YouTube link, share that link to someone else so that they can also benefit out of this discussion the way you have. Edwin Austin Mkalazi is my name. We had Dr. Arnold Sekanjako. I've worked with Brinko and Didmas, but of course there are very many other people out there that you never see that make sure that this show comes through at this time. From the entire team, wish you a blessed night. Next is Soul Moment.